Good evening, everyone. My name is Tisha, and I will be speaking about Part 1, a communication plan for proposed quality improvement project. So who will this presentation be intended for? Our primary audience members, who will be the ones that are actively participating in this quality improvement project, will be all the members of the NYP Weill Cornell Medical Center's nursing department. So this includes all staff nurses, patient care directors, clinical assistant managers, nursing supervisors, and the chief nursing officer. Other groups that we want this presentation to be for include the financial operations of the enterprise as well as the quality improvement team. Another group of individuals that we do want to mention is patient and family members, because they will be indirectly affected by this quality improvement plan. Some communication considerations will include being mindful of everybody's different work hours, especially in the nursing profession. So we have to be able to communicate our proposed plan effectively, whether our nurses are working 12-hour day shifts, night shifts, 10-hour evening shifts, Monday through Friday schedule, 9 to 5. The work schedule varies greatly with our participants. Therefore, careful consideration should be taken into account when deciding on the method to present this quality improvement project. So, secondly, communication about this project should be clear, concise, and to the point. There should be no unnecessary slides or information that is not absolutely imperative. This is because we need to consider the large amount of information, emails, documentation that nurses and other staff go through on a daily basis. If communication about the proposed plan is not concise, staff members may lose interest and reduce the chances of participation. Lastly, because consideration should be taken on the large quantity of information that our intended audience receives on any given day, we need to ensure that the incentives, benefits, and overall purpose of the project is described at the beginning of the presentation to grab attention and engagement throughout the duration of the presentation. So some of the communication plan options that are available include live in-person presentation, the live stream PowerPoint presentation with audio narration, an email format, written format on the NYP employee website, or video conferencing. So ultimately, the decision was on the live stream PowerPoint presentation with the audio narration. This way, there will be multiple scheduled live stream presentations to accommodate as many viewers as possible. The presentation will also be recorded for viewing again for those who were unable to attend the live stream sessions due to work schedule conflicts. This way, viewers can access the presentation information after it is recorded at different times of the day, depending on their work schedules. Also, there will be a visual and auditory portion for anyone who may be visually or hearing impaired. This method of communication was chosen in comparison to live in-person presentation and video conferencing because it allows for more flexibility with all participant schedules and locations. So how does social media play a role here? We are going to be utilizing YouTube directly to disseminate the proposal plan, and then we're also showcasing this proposed plan in the future through social media platforms such as LinkedIn. What are the barriers for carrying out this communication plan? So there are several. It is going to be a little difficult to have 100% viewership from targeted audience, but we will try to get as close to 100% as possible. Because this presentation will be live streamed and not in person, it will be impossible to answer the questions face to face, and it's going to be very difficult to gauge engagement from participants, but hopefully these barriers are going to be overcome by other advantages that we have with our live stream PowerPoint and audio narration. So, how can we foster smooth and positive communication in this project? Definitely allowing multiple opportunities for suggestions, input, and feedback. That is definitely appreciated, and all suggestions and feedback are taken into consideration because this project is a work in progress, and we definitely do want to hear from those who are going to be directly involved in this quality improvement plan. So we also want to make sure that throughout this entire project, from now all the way to the end, that the information conveyed and presented to all our participants will be concise, simple, and organized. This communication plan will meet culture and diversity needs within the organization through inclusion of all intended audience members discussed earlier without any bias towards any culture, race, religion, age, gender, and disability. The presentation will consist of written, auditory, as well as visual components. My name is Tisha again. I am a registered nurse here at Weill Cornell Medical Center. I've been here for 4 years and have worked on 14 South, which is our medical surgical step-down amenities unit, and I'm currently now working on 4 South, which is the cardiac care unit. So I'm going to be speaking tonight about the Part 2, implementation of a 12-week mindfulness and resiliency training program at a large urban medical center, which is here, NYP Medical, Weill Cornell Medical Center, to reduce staff nurse turnover. So first off, I just want to show you guys a quick video about the issue that we're going to be discussing tonight. I'm just going to go ahead and pull that up real quick. Let's see here. All right.
Some days are better than others. Today I felt anxious and nervous, and I couldn't stop thinking about my patient's suffering.
Am I even making a difference? After what he went through, I don't know if I can help at all. Maybe I should find another line of work.
She was so distraught, I couldn't take away her pain. I was absolutely exhausted after seeing her.
These are the voices of compassion fatigue. It can happen to anyone, but the people who seem to be most at risk are those medical and mental health providers who care, day after day, for patients who are struggling with significant symptoms. Compassion fatigue is not burnout, and it is not simply overwork. It is defined as absorbing the patient's suffering through the experience of taking care of that person. As a provider, empathy might be your most valued skill. It is also the same trait that can make you vulnerable to the experiences of your patients. And you might find yourself suddenly feeling exhausted, frustrated, or sad. Thoughts and feelings might become overwhelming. Cognitive abilities can be impaired, and you might feel completely lost where you used to feel the most confident. Providers are especially vulnerable when they are busy in their clinics or hospital schedules and find themselves prioritizing their patients over their self-care and connection with others. Any provider who cares for people with trauma histories can be at risk for compassion fatigue. Providers can protect themselves.
All right, so the area of concern that you all have already seen is the increase in compassion fatigue, burnout, and staff turnover experienced by nurses throughout the hospital-wide system. So nurses spend a significant portion of their shift at the bedside of patients who are suffering, and this increases the risk for compassion fatigue, which is a combination of burnout and secondary traumatic stress. And with the presence of compassion fatigue experienced by nurses throughout the hospital, nurses may experience physical symptoms, and these include like muscle tension, poor judgment, anger, fatigue, headaches. All of this can increase the use of sick days, which will lead to staff shortages and increased staff turnover. Ultimately, this will actually decrease overall productivity, increase risk for medical errors, and even decrease the quality in patient care that we provide. So as COVID-19 impacted patients, healthcare providers, healthcare systems, and overall quality of life at a global scale, compassion fatigue, burnout, and turnover can be seen in virtually every healthcare system around the world. So some of the examples here shows that data was collected via an online self-report questionnaire across multiple healthcare centers in Spain during the height of the COVID-19 pandemic. So the data was measured using the professional quality of life scale, and this is a very important measure that we use for measuring compassion fatigue. So results were significant for high compassion fatigue at a total percentage of 60.5% of participants and medium levels of burnout from 48% of participants. So this was the study in Spain with some participating healthcare centers. Another study, this was here in the US, it shows the rate of staff turnover, especially for registered nurses. As you can see here in 2019, it was 15.9%. And the staff turnover bumped up, increased to 18.7%, which is a 2.8% increase for staff RN turnover. So this is important because the average hospital will lose or save an additional $270,800 per year for each percent change in registered nurse turnover. And therefore, I am proposing a quality improvement plan to implement a 12-week mindfulness and resiliency training program. And this program is for all nurses, and it's comprised of all these items, all these different strategies to help decrease and lower the chances of compassion fatigue and burnout, therefore decreasing staff turnover. So we have here in the program, we're going to be focusing on one or more of these topics throughout the each session in this 12-week course. So there's breath awareness strategies, how to facilitate gratitude, mindfulness, how to apply that in your daily life, mentorship opportunities, counseling opportunities, reviewing debriefing techniques during like a code or during an emergency situation, having the resources for live stream in-person exercise classes such as yoga and Pilates, and maximizing work schedule preferences so that you can maximize the amount of rest throughout the week. So the primary outcome goal is to decrease staff turnover by at least 2% by May of 2022, so a year from now, after the implementation of this training program. Our secondary outcome goal is to decrease compassion fatigue and burnout, and that's going to be utilized similar to the other study about using the professional quality of life scale. So we're going to give a pre-test, and then we're going to implement the training program. We're going to give an immediate post-test, and then we're also going to give another post-test right at the 1-year mark. So some of the resources include program coordinators, which will help organize the details and logistics of this training program. We're going to have breathwork instructors, yoga and Pilates instructors, and they will be essential for the makeup of these sessions. And then we're going to have 2 registered nurses per unit to be on the scheduling committee, as well as a group of individuals who will be collecting data for us to synthesize all our survey results and hospital results for staff turnover. Some other resources that we'll need, physical resources, will include notebooks, pens, yoga mats, yoga blocks, and the proposed budget plan. So this is the implementation. This is basically the timeline of how this is all going to work out. So in May of 2021, which is right now, we're going to be sending out flyers to all units. This will help promote staff engagement for the proposed quality improvement program. The flyers will advertise several educational sessions that will be taught by our program coordinators, who will provide more detail on and lead a discussion regarding evidence-based mindfulness and resiliency training. Also, we're going to be grouping everybody up into 8 to 12 staff members each into these small groups. So at the beginning of June, all participants will take a survey consisting of questions measured with the professional quality of life scale that we had mentioned. So this will kind of serve as our baseline to determine how much compassion fatigue and burnout there really is. And then in mid-June, we're going to initiate the training program with bi-weekly sessions. And of course, participants are free to sign up for additional classes. And then this is going to go for 12 weeks, and that's the end of our training program in September of 2021. We're going to do a post-test right after that. And then a year from now, which is May 2022, we're going to also have our final survey test. And then between the months of September and May, we're going to have monthly progress check-ins by our program coordinators. And then ultimately, at the very, very end of May 2022, we're going to measure those outcome goals that we had discussed. So right here, those are 2 outcome goals. We got the decrease in staff turnover by at least 2% or more. And then that's just measured by the results from 2020 and 2021. And same with the compassion fatigue and burnout scores we're going to use from those pre and post tests. So in summary, all in all, this program will help to achieve mentally, emotionally, and physically healthy work environments for all nurses in the nursing profession. And this will ultimately help to improve job satisfaction. So we'll decrease that staff turnover, hopefully, and will ultimately provide improved quality patient care. So thank you everyone for your attention and time. I really appreciate it. And I hope to see you soon. And these are our references here.